gynecology, and the emergency room. Y'all here with me? She then spent several years working in community clinics throughout the territory, including the sister islands of Virgin Gorda and Alingana, as well as Rotown, East and Longlook, and even Her Majesty. She is the medical director of the Wellness Center Medical Clinic, where her aim is to bring holistic approach to healthcare with emphasis on prevention and caring for the body, mind, and spirit for the treatment of ailments. Since it is now known how many diseases are caused by excess weight, Dr. Lewis has dedicated much of her focus to managing chronic metabolic diseases, including obesity and diabetes. She has also completed her postgrad diploma in obesity management to help her patients achieve better health. She is the president of the BBI Diabetes Association, and she's very busy, where she and her team are spearheading programs to provide glucose monitoring to the community, including continuous glucose monitors to type 1 diabetic children for free. She also had been part of the first response of COVID pandemic, working with BBI, HSA, and then the national sensitization effort around the COVID-19 vaccines. She's always willing to provide education to the public regarding health issues, especially related to obesity and diabetes, whether in schools, churches, and business, and expos. Acts of service in the community, which earned her recently being granted a Paul Harris Fellowship. As a person of ideas worth sharing, she was also invited to speak at TEDx Rotown in October this year. All of this while being the best mom she can be for 2 wonderful boys. As an added bonus, she is fluent in Spanish, having spent some younger years in Cuba. Thomas Edison once said, "The doctor of the future will give no medicine, but will interest the patient in the care of the human frame, diet, and in the cause and prevention of disease." Dr. Lewis is certainly a doctor of the future. Let's welcome Dr. Sharlon Lewis.
Thank you. Please give yourselves a round of applause. If y'all just look up here, this is gorgeous thing. So my 2 colleagues, they've spoken before about some issues, and I kind of wanted to, let's go into that. So Dr. Martin spoke about self-care, being able to take care of yourself. I would say in my practice, I do focus a lot on metabolic disorders, obesity being one, diabetes another. And a lot of what I see is that when patients are just fed up, when people are just fed up and they just need something else, then they're going to come to me and we find solutions together. I've seen patients empowered because they've taken that step, they're actually taking care of themselves and doing what is necessary. I've seen confidence levels go up. I've seen self-care on fleek. Some of them have to tell me, listen, you're going to still have to wear a shirt, especially guys. You're going to still have to wear a shirt next summer, and ladies know you cannot walk around in a bikini. As Dr. Stoutt-Ottley said, we do liaise a lot in terms of patient care. So there are things that people think, okay, yes, I could just do this at home and just use some medicated shampoo to be okay. The reason that we are here, and the reason that we, talk at these kind of events is because we want to bring awareness to the actual medical conditions. So today I'm going to talk about the link between diet and your hair. As Dr. Stoutt said, your hair is really a reflection of what is going on in the root. And when you have vitamin deficiencies, that's when you're going to see a lot of problems being caused. Some of the conditions that she referred to, as a thyroid disorder or diabetes, they can cause vitamin issues, and we'll talk about that. PCOS is something that's related more to hormones, as well as pregnancy, because pregnancy, as much as we enjoy, our children, we love them so much, it is an acute situation when it comes to your hormone levels, and there are a lot of changes that happen within not even 9 months of the pregnancy, within maybe a year. Because there are changes that happen after as well, as you mentioned, the hair falling out because of hormonal changes. So that being said, at the end of the day, A good diet is really the basis for everything. Whether it's your health, whether it's your beauty, and then that reflects into self-confidence. So what does that mean? So the WHO recommends that adults have about 5 to 6 servings of fruits and vegetables a day. Can anybody tell me what is 1 serving of 1 fruit, 1 serving of 1 vegetable? Not all at once. Say again? 8 grapes. 8 grapes is 1 serving? 3. I don't know. 3 what? 3 what?
Mango. Yeah.
3 mangoes is not 1 serving. There's many servings. As a mango lover, I understand where you're coming from, sir. That is many servings. I asked that question because at the end of the day, a lot of us don't even know what a serving is supposed to be like. So, on your plate, does anybody know what your plate is really supposed to look like? Anybody ever heard about half your plate being vegetables? Yeah. How many of us do that? One. I will say this, we do not get enough fruits and vegetables in our diets. For those of us who are moms and have children to take care of, the kids don't always like them, and usually what you cook for the child is what you're going to eat yourself. But I am going to say, like I said, according to WHO, you're supposed to be having between 5 to 6 in a day. A mango serve is considered 1. So if you're having 3 mangoes, that's 3 servings. Kudos to you. What? So let's say about half cup. This is why I ask these things, because about a half cup is actually a serving of fruit, of most fruits. There are fruits that have higher and lower sugars. Mango is a high fruit. Yes, Ricky. No, 1 measure cup. Those of us who bake know what a measuring cup looks like. So for the sweeter fruits, and honestly, tropical fruits like the mangoes, pineapple, what else we eat that's really sweet? Sugar apple. Bananas. A half cup serving is about 1 serving. Okay? For less sweet fruits, your berries, your grapes, so that 8 grapes don't sound right to me. A 1 cup. 1 cup of grapes. You can have 1 cup of star fruit as well, 1 cup of guinea. You know, the lower sugar fruits, right?
Okay, so I like foods, I love foods. So my question now is, can I increase my food intake if I increase my water intake?
It doesn't really work that way, no. Because at the end of the day, I'm glad that you asked this question. The reason why you want to kind of limit your intake of even fruits is because everything kind of adds up, right? You're supposed to be getting a certain amount of your diet from carbohydrates, proteins. What's the other food? What's the other macronutrient? No.
Fat?
Yes. Fats. Fats, carbohydrates, proteins. So you're supposed to have a balance of all these things. No. Can anybody tell me, of the 3 of those, which one has the most calories per gram?
Fat.
Who says fats? Raise your hands. Who says carbohydrates? Raise your hands. Has the most calories per gram? Those who said fat were right. So 1 gram of fat. So let's say that equates to maybe a tablespoon of olive oil, which all of us love, and we think it's so healthy. But 1 tablespoon of olive oil has the same amount of calories as it was a whole cup of rice. Okay, and we do need fat in our diet because we have certain vitamins that we need to absorb. And of course, those of us who are in the health and beauty industry know that fats, all the vitamins, your vitamin A, your vitamin D, vitamin E, those are important for your health and for your beauty, right? For your skin integrity, correct? So you don't need fat in your diet, but you need limited amounts, and you're going to need the healthier versions. What is the difference between having, let's say, a red meat source bacon and having an avocado? What's the difference between those 2? Right, so the one that has red meat is going to have something we call hydrogenated fats, and that's going to go into your body as something called low density lipids. For those who may have had family members with heart diseases and that kind of thing, that actual type of cholesterol in your blood is the one that's most associated with developing heart attacks and strokes. Okay? And that's the one that you get more from red meat. Now, I am not vegan. For anybody who's like thinking that I'm trying to push this plant-based, I am not vegan. And one of the main reasons I have an issue with veganism is because of a certain vitamin deficiency. Don't answer. Yes, tell me.
B12.
It's B12.
Yeah.
I used to be a vegan, so I feel
I feel like we should have prizes.
I know, right?
We want to start.
We should. And vitamins are very important. So I don't really like diets that are like super restrictive because very often what you're going to find is you're going to have some kind of deficiency. For people who follow the vegan diet, they very often lack fats a lot of times and vitamin B12. Vitamin B12 is only found in animal sources. So if they're getting enough B12 when they're taking a supplement, that's actually going to come from an animal source. So I have my hesitations with that. I also have my hesitations with something like low carb and ketogenic diets. Because with those diets you don't get fiber. And fiber, the lack of fiber is also associated with digestive issues and an increased risk for heart disease later on in the future. Okay? Some other conditions that we're kind of skimming around that have to do with vitamin deficiencies, things like thyroid disease. A lot of us actually don't get enough iodine in our diet. So in my practice, I do see a lot of people coming in with low thyroid functions. It does contribute to weight gain because once your body is not able to kind of use all the food that you're taking in, it's going to store it up as fat. And I often tell people, listen, fat is like the mafia. When your body is going to store it up in fat cells, it's easy to get in, but it's hard to get out. So what you need to do is you need to reduce the intake, which a lot of us don't do after we turn 18 and 19 years old. We're still eating like if we're in high school. We're not growing anymore, unfortunately. I am stuck at this height, so I know my intake has to be limited as opposed to my child here who, can eat down the house. So looking at portion sizes, again, is also very important, and the sources of what you're getting, where you're getting the food from. Very often, yes, we love how the food tastes, and from the Diabetes Association point of view, we try not to harp on things too much. Please, oh boy. Not saying that you cannot have it, okay? Or we cannot be doing these things all the time. So I think when it comes to dieting and eating healthy, it's not about denying yourself all pleasures in life because who really wants to live that way? I'm really giving Dr. Martin more work by doing that. But that is stressful. So you don't want a healthy, balanced life. But rather than just thinking about how good it tastes on the tongue, we have to start thinking about what is it doing inside the body. When you come to me, a lot of times I do vitamin levels, and even as Dr. Stoutt will know, looking at observing what might be deficient, conversations with you, it's then very easy for us to know what you might need in your diet you need to focus on, and what vitamin supplements might actually be beneficial. And Dr. Stoutt and I have a debate about collagen supplements, but I do like it. CMOS is another source that I like to use as well. That's something to do with iodine and supporting the thyroid because I am no spring chicken. I only look this way because of the genes and Dr. Stoutt. So I do try to practice what I preach, and so when I found that my thyroid, I was having issues with my thyroid function, I knew what supplements I needed to give myself as well. Sometimes it's really just paying attention to your body and saying something is not right. In diabetes, we often talk about the science of diabetes, and I don't really like to talk about it because diabetes is one of those things, it's silent. We actually don't get science until it's pretty far along. So we always encourage persons to have like regular annual checkups, especially for us women, your cancer screenings, from 40, starting with mammograms, not as bad as you see. They're really not that bad. And from about 25 years old to start the cervical cancer screenings, including your HPV screening. And for those who have children and a bit younger, especially our girls, we do have the HPV vaccine available at the public clinics for free. And the HPV vaccine, anybody ever heard of it?
Tell us.
So the HPV vaccine is a vaccine that's given to women up until about the age of maybe 40, depending on risk factors. that can prevent the major types of human papillomavirus, which is a major cause of cervical cancer. It causes about 80% of cervical cancer. And there's a vaccine now that we can give, and in the UK it's been given for a couple of years, and they've seen dramatic reductions in the incidence of cervical cancers. So pap smears, yes, we still have to do them. It's every 3 years now. The guidelines say every 3 years now. But then there is a vaccine that we can give to our children, and I think they do give them to boys as well, because they don't really suffer as much. They do get certain cancers of the genital area, but our girls are the ones that tend to get cervical cancer more. So you might want to check into getting the vaccine done for our kids. Okay? So yes, balanced life, balanced diet, recognizing when something is wrong. Please come and see one of us so that at least we can try to identify the problem and see how we can help you. In terms of what diet might be best for you, you're an individual, so I'm not going to stand here and be like, well, you need to eat so and so and so. It's about looking, kind of really assessing what is best for you and then going from that point of view. Thank you.
Thank you, darling. Does anybody have any questions? Oh, yeah. Hold on. This is your water. Drink your water.
I didn't even talk about hydration.
Thank you for that presentation. I'm very curious to hear about the debate with collagen supplements. I'm really curious to hear your points of view a little bit more.
So I do collagen supplements. It's just, in the back of my mind, like I'm getting older, like mid-40s now, you know, to support my skin. Dr. Stoutt will attest to the fact that darker skin, we tend to not have as much collagen loss as we get older, because the color of the skin actually protects the underlying fibers, and so we don't get much damage to our collagen. For collagen too, I do like it because it can help with gut health as well. So it's not just about skin, joints, it's also about your gut. I have a lot of clients who come in with symptoms of irritable bowel disease. But like I said, they just have like certain vitamin deficiencies, and you can just kind of like tell. So I do include collagen in the supplementation list.
For me, collagen, it depends on the type of collagen. It has to be hydrolyzed collagen. Every collagen is not made equal. And so, because collagen is one of the building blocks of, every single cell in our body, using the right collagen to have access to that cell is what's really important. And so, a lot of times you might see brands that will tell you bovine collagen, different types of collagen, but if you don't see that word hydrolyzed, it may not be as valuable to your nutritional system. It will just kind of pass on out. And then the other part of the debate is that people think that drinking a whole bunch of collagen is going to make you look younger. It doesn't work that way. It does definitely work to help the overall health of your cells. And we're at a Health and Beauty Expo, and healthy cells are beautiful. And so once you do those supplements and understand that on a cellular level, you are creating change and improving the health of that individual cell, that's great. But then when you want to talk about anti-aging collagen influence, you're going to have to stimulate the collagen in a more physical or more manual manner in order for you to see the results you want. Because I have persons who may believe, like, you have acne and you have a lot of the pores, the little scars that acne creates. And if you drink a whole lot of collagen, then your skin is going to bounce back in, it's going to get smooth. No, we actually have to create some micro injury to those little bit of scars so that your body can then recruit that collagen that you're drinking to hover into that area to heal that scar, and then that scar is lifted. So it's a whole process, but you can definitely start off by choosing the right collagen, make sure it's hydrolyzed.
And then the right procedure available at Riverderma. I will. Thank you.
Question, from what age can you give the boys the